In this video, I want to share with you a hidden cause of heart attacks that is rarely discussed. The reference comes from a book called Hidden Epidemic by Dr. Thomas Levy, a well-known American cardiologist. He is recognized for his research on the strong connection between dental health and systemic diseases. Dr. Levy presented some striking data. Among 101 patients who had suffered a heart attack, 78 of them were found to have the same bacterial DNA in their bodies that is also found in root canal infections. That means the bacteria hiding in the mouth can actually end up in the heart. This raises a big question: how do these microbes travel to the heart, and what role do they play in heart disease? Interestingly, the same bacteria were also detected in patients who had strokes when their blood clots were analyzed. Further research showed that most of these patients had hidden infections at the roots of their teeth, something called a dental abscess. The problem is that these infections often have no obvious symptoms, so people remain unaware of them. Over time, abscesses can silently damage the surrounding bone and tissues. Dr. Levy explains that long-term chronic infections like this don't just affect the teeth. They can trigger systemic inflammation, contributing to conditions such as heart disease, arthritis, chronic fatigue, and other inflammatory illnesses. One major condition linked to this is periodontitis, which often develops without clear signs. Unless you visit a dentist and undergo advanced imaging, such as 3D cone beam scans, you may never know it exists. Some blood tests, like the C-reactive protein test, can also indicate hidden infections in the body. The danger is that when you chew food, you may actually be pushing bacteria deeper into your lymphatic system, the system designed to protect you from disease. Once this system gets overwhelmed, inflammation and infections spread throughout the body. According to Dr. Levy, more than 25 million people worldwide undergo root canals every year, and these procedures themselves may contribute to hidden infections. Here's why. During a root canal, the soft tissue inside the tooth, called the pulp, is removed. This pulp contains nerves, blood vessels, and connective tissue. The tooth is then sterilized and sealed. But inside the tooth are thousands of tiny tubules, and during the process, many of them get damaged. These tubules are part of the tooth's defense system. Once they are compromised, bacteria can settle inside again, leading to chronic infection. Such infections may exist in the teeth, gums, jawbone, or even tonsils. If your immune system isn't strong enough, the bacteria produce toxins and oxidative stress, a condition where harmful free radicals build up in the body. Without enough antioxidants, your body can't fight them off effectively. Think about it: tower mouths contain over 500 types of bacteria, viruses, and fungi. These microbes constantly release toxic byproducts. The immune system is always battling them, and over time, this can even lead to blood clots, fatigue, joint pain, gum sensitivity, or unexplained weakness. So, what can you do if you suspect you might have such hidden infections but aren't sure? One simple step is to support your body with antioxidants. Dr. Levy recommends liposomal vitamin C. One of the most effective forms of vitamin C, it penetrates deep into cells and reduces oxidative stress. Taking about 500 milligrams 3 times a day can help keep a steady supply in your body, since it is water-soluble and doesn't stay in your system for long. Unlike regular vitamin C, liposomal vitamin C is better absorbed and doesn't usually cause digestive issues. This won't directly eliminate an infection, but it strengthens your antioxidant network, reduces inflammation, and supports immunity. If your symptoms improve: less fatigue, more energy, reduced sensitivity, it may be a sign that you need to look deeper into whether the root cause is linked to dental infections, diet, poor sleep, or stress. This was just an overview of the hidden connection between dental health and heart disease. If you'd like to learn more about related topics like atherosclerosis, I have other videos linked for you to watch. Take care of yourself, and I'll see you in the next video.